Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Hey ladies, welcome back to today's episode. I'm so excited to be joined today by Dr. Shani Belgrave. Dr. Belgrave is a board-certified, fellowship-trained bariatric surgeon, and she is actually, y'all, one of Atlanta's top doctors. She is known in her area for being really compassionate and providing personalized care and a really personalized approach to weight loss surgery. Dr. Belgrave, it is so great to have you here today. That was a very short introduction to a very awesome career that I know you have. Tell us a little bit more about you and what you're doing in Atlanta.
Thank you so much, Dr. Brittany Anderson, for the opportunity to join you on your podcast. I am so excited to be here to talk about something I'm very passionate about, which is health, particularly as it relates to obesity and the power of metabolic and bariatric surgery. So that's my main area of interest.
There you go. Well, let's get into it. And tell us, I want to chat about this a lot as we go on, but you have a practice there in Atlanta called Oneka Bariatrics and Wellness. Tell us a little bit about that practice, how long you've been in practice, what your day is like. Just give us a little bit of the insight into your life daily.
Sure. So I came out of training in 2016. I've been in practice since then. I'm super excited to share that I have recently launched my boutique wellness experience under my own umbrella, which is Oneka Bariatrics and Wellness. And so it's an opportunity for me to deliver care the way that I think is important, which is a patient-centered, individualized approach. And so I'm doing everything from medical weight loss to lifestyle coaching, and of course, bariatric surgery. The most common surgeries that I perform are the sleeve gastrectomy and the gastric bypass to address the problem of morbid obesity.
Gotcha. And your journey to bariatric surgery is really incredible. You went to medical school at Brown University, right? And then did your general surgery residency at the University of Maryland, and then did your advanced fellowship in minimally invasive and bariatric surgery at the University of Washington. And then after completing all your training, like you said, started this wonderful practice at Oneka Bariatrics and Wellness. And that's a really big transition, especially into having a boutique practice. What inspired you to create Oneka Bariatrics and Wellness? And tell us just a little bit more about your approach to talking with women about weight loss surgery or just about weight loss at all.
Thank you so much. I love the opportunity to speak about health, wellness, inspiration, and metabolic surgery. So I became a surgeon because I really appreciate the ability to put your hand on a patient, perform a procedure, and then see many times instant results.
Mm-hmm.
So, with general surgery, if someone has problems with their gallbladder and you take their gallbladder out, oftentimes immediately they're like, oh wow, that pain, that nausea is gone. I'm so relieved. And it feels good to be able to be a part of something like that. With weight loss surgery, many patients come to me really just looking for hope. They've been trying to deal with weight loss for years, gaining, losing. They've tried dieting, they've tried exercise, and they're beginning to have joint problems, sleep apnea, high blood pressure, diabetes, and their health is deteriorating, or they haven't started to have those things, but their weight is to such a point that they know those things are inevitable. And so after doing weight loss surgery, and seeing these remarkable improvements in people's lives, that's how I knew that this was really a specialty where you could really have huge impact. And one of the things I love about weight loss surgery is that, you do the surgery and then the patients have many follow-ups. So I'll see the patients 2 weeks later, then a month later, then 3 months, 6 months, 9 months, 12 months, and then at the first annual appointment. And then after that, minimally, I should see the patients once a year. So I say all that to say that being a surgeon, I love that I get the best of both worlds. I get that oftentimes immediate sense of someone's condition improving, but then it's a little unique in that I have such long-term follow-up with my patients. And so most patients, they lose most of their weight by that first year. They can continue to lose into the second year. And so I've really enjoyed getting to be a part of that journey and really getting to know my patients. Usually I'll know where they work, what they do, what their kids do for fun. And I love that kind of connection that I'm able to have with weight loss surgery.
Right. And that's so important, right? To have that connection with your patient because it's quite a journey that they're on. What is that process usually like before people make the decision to do weight loss surgery? Because I'm assuming that weight loss surgery is not for everyone, but that there are other things like you do at Oneka Bariatric and Wellness. You mentioned that you do some medication weight loss and other things as well. How do people make that decision that surgery is the next best option for them?
This is one of my favorite things to talk about. Metabolic surgery is the most durable and effective treatment for morbid obesity. Obesity is just the medical term for carrying excess body fat. And I always tell everybody that carrying excess fat, the fat is not inactive. It actually creates inflammation in the body that then causes all sorts of different conditions. And so only 1% of eligible patients undergo weight loss surgery. So it is very underutilized given its tremendous impact.
You say 1%?
1%, 1%. And so that's why I think that every patient that is morbidly obese should have a consultation with a bariatric or weight loss surgeon, because I think that many people, A, don't even know much about it, don't even consider it as an option, or have this idea that it really has to be a last resort therapy. And it really doesn't. Depending on your body mass index, depending on your overall health status, in some patients, it can actually be the first line thing that you do. There are some patients who have done medical weight loss and eventually transition to weight loss surgery. The medications they're effective tools, and I'm glad that there's something we have in our armamentarium because obesity, unfortunately, is a chronic condition. And now we're kind of seeing how these medications can be used along with surgery to really maximize the longevity of people's transformation and results.
Gotcha. That makes so much sense. And you were kind of starting to get into one of the questions that I wanted to ask you, and that was about some of the common myths or misconceptions that you want to clear up about weight loss surgery to kind of help people who may be considering it. And one of them we've already started to talk about, and I walked you right into that one by saying that that people consider weight loss surgery after they've tried other things. And you've let us know that it does not have to be a last resort or, the last option. What are some other myths or misconceptions that you hear from patients or that you just know are out there that you'd like to clear up?
Again, another one of my favorite things to do is debunk myths
Yeah.
around obesity and health and weight loss. So, some of the common things are one, that having weight loss surgery is somehow cheating or taking an easy way out. And that is completely false. Obesity is a multifactorial condition. It is not solely a matter of willpower. There are people that are making dietary modifications and exercising and are still unable to get to their healthy goal weight. And even with weight loss surgery, you still have to do certain things. It takes effort, consistency. It is a true journey. And that's why I enjoy working with patients, because it's a partnership. It's something that we do together. So that's one of the myths, is that it's cheating or taking the easy way out or shortcut. It is not. Another myth is that weight loss surgery is super risky. Um, and it's just not. The data backs that up. It is just as safe to have bariatric surgery as it is to have your gallbladder removed. And I think a lot of people don't realize that. Almost everyone knows someone that has had their gallbladder removed. And so, as a surgeon, I think it's so important that I let people know that all surgery has risks. It's the nature of surgery. However, those risks are low. And with follow up and, maintaining care with your surgeon, any complications, they can be evaluated and treated. And so, risk benefit, it is a very safe surgery, especially given the amazing outcomes. After weight loss surgery, many people are no longer diabetics. Many people have improvement or resolution in high blood pressure. There's so many benefits that make surgical risk, in my opinion, acceptable.
Absolutely. And as someone who treats hypertension and diabetes all day long, every day, every week, every month as a family medicine doc, to be able to see some of those huge improvements that come behind bariatric surgery is so great. And just to see the change in patients, right? Not even just the diagnoses that change that I'm looking at on a chart, but you see a mindset shift, right? You see a mindset shift, you see a mental shift. What does that look like to you? I know that I've heard you say that bariatric surgery isn't just about losing weight, it's about becoming the ultimate you. Can you share what that looks like when you see that shift in patients after the procedure, when they're coming back to you for those follow-up visits and are losing weight? What does that look like, Dr. Belgrave?
It is beautiful. It is beautiful. I remember when I think of my patients, even sitting here, I can remember the stories from, oh my goodness, Dr. Belgrave, I was able to walk the entire amusement park with my kids for like the first time. And they're literally almost moved to tears because they're able to be free. They don't have to worry about, well, if I go here, am I not going to be able to participate? Am I going to be tired? It's like, no, I was actually able to do this. And I tell my patients all the time, you guys are motivating me to push myself to do things maybe I haven't done, because a lot of them are now traveling. I literally have a patient that's traveling and doing 5Ks.
Oh,
I didn't
wow.
even know that was a thing, that you can travel and participate in 5Ks. So those are what those stories look like and feel like. And it's just why I'm grateful to be in this specialty.
Absolutely. You mentioned the 5Ks. I had a guest early on in the podcast named Jessica Jackson, who is like a 5K enthusiast. She is fantastic. And we had a whole show about 5Ks. And you're right, you can travel and do them. There's an awesome one out in Napa that maybe you and I get together and do that one. It's like you run for a little bit, then you stop and do some wine tasting. And then I have a 5K these days. I love it. I love it. For women, Dr. Belgrave, who are struggling with weight and they're wondering if a bariatric surgery is right for them or if it's an option for them, what are some factors that people have to consider when they're thinking about, do I talk to a bariatric specialist or am I a candidate for a bariatric surgery?
Sure. So there's some really simple things you can do. One is you can go online and just look up BMI calculator, body mass index calculator. That is the BMI is a number derived from your height and your weight. It's not a perfect tool, it's not a perfect tool, but it does correlate well with obesity. So for most people, a body mass index of 30 means that you are obese. And so most insurances will cover bariatric surgery if you have a body mass index of 35 or greater with a health related problem, or if you have a body mass index of 40 or greater, even if you do not have any weight related health conditions. I'm a strong proponent of, if you feel that your weight is an issue, and that this weight is either impacting your health or ultimately will impact your health, I would say you should get a consultation with the bariatric surgeon. You have absolutely nothing to lose. If your weight is not quite to the point where you're a candidate for weight loss surgery, they can still guide you and counsel you and give you other information. And I think that information is power. So the more you know, the more informed decisions you can make.
Gotcha. Absolutely. Will you tell us a little bit more? You mentioned earlier how closely you follow your patients after the surgery. What does that process look like for patients post-op? So post the surgery, when you see them back at a few weeks, a few months, what are folks doing during that time to aid in their weight loss and their overall best health after the procedure?
Sure. So after weight loss surgery, I will see all the patients at a 2 week follow up, and I'm checking incisions. I'm making sure that things are healing appropriately and that they're passing all their milestones in terms of tolerating getting their fluids down, that they're drinking okay, that nausea and vomiting is not a problem, that they're staying hydrated, that they're not having pain that's beyond what I would expect for the normal post-op course. So very diligently looking for any potential issues, checking calves, making sure there's no signs of blood clots. I always counsel everybody that after surgery, it's important to do plenty of walking to decrease the risk of blood clots. Then I see them 2 weeks after that. That's a 1 month follow-up. And that's where I really start to hone in on the weight, start tracking the weight closely and see how they're progressing. With weight loss surgery, patients don't go home right away and start eating solids. There's a gradual diet progression that goes on for several weeks after surgery. So normally by the 6th week after surgery, people can eat a variety of textures and consistency of food, but it is a gradual diet progression, clear liquids to then fuller liquids to then pureed and then soft foods. And then eventually I release people to eat raw vegetables and things that are harder to digest. So that's kind of what those initial follow-ups look like. By the time we get to the 3-month follow-up, I'm checking a whole new set of labs to start seeing, wait a second, are we starting to see some improvements in that hemoglobin A1C? Are we, what's going on with the rest of the blood work? Because sometimes we can start to pick up on improvements as early as the 3 months. And also we're going to be monitoring to make sure that you're not having any issues with vitamin deficiencies, because there is a risk of vitamin deficiency. And so I want to make sure you're taking your vitamins and that we're keeping an eye on your lab. So that's pretty much what the follow-up looks like. And then as we get further out, 6 months, 9 months, 12 months, we're really tracking your overall weight loss, how you're doing with your exercise. And again, in close partnership with your PCP, how your health is improving with the weight loss surgery.
Absolutely. That makes so much sense. You mentioned early on that the two most common bariatric procedures that you perform are the gastric sleeve and gastric bypass. Are those right?
That's correct. And nationwide, those are the two most commonly performed bariatric surgeries.
It's just the general, go very general for us, but the difference in those two procedures, and how do people choose which one, or how do you work with them to choose which one they do?
That's a great question. So these surgeries are done with minimally invasive techniques, which means small incisions and a camera, and that can be laparoscopic or it can be robotic. And so with the sleeve gastrectomy, that operation is where we surgically remove about 80% of your stomach. Someone thought that the remaining part of the stomach looked like a sleeve, like on a jacket. And so that's why it's called the sleeve gastrectomy.
Never knew that. There you go.
Also known as the vertical sleeve gastrectomy. So sleeve, VSG, sleeve gastrectomy, those are all the same operation. Mm-hmm. The gastric bypass, I always tell patients that the main difference between the sleeve and the bypass is that with sleeve, we are only operating on your stomach. In the bypass, we are not only operating on the stomach, but we are also rerouting your intestines. So the gastric bypass is what we also call malabsorptive, because with that rerouting, you don't absorb as well as you did before. So that does aid in weight loss. So those are the main differences. In terms of deciding which is right for a particular patient, that's something that I always go through at the initial consultation, because sleeve gastrectomy does come with the risk of reflux. So people that have severe heartburn, reflux, it's a conversation. I tend to recommend the bypass. The gastric bypass is more of an anti-reflux operation. So it's kind of individualized based on some different things that are going on with the patient's history, as well as their weight, how much weight they need to lose.
That makes so much sense. Dr. Belgrave, I love how you break things down. And I know that your patients appreciate that too. And, to women who are listening to this episode, I know that you also appreciate just how you take the time to make sure that we understand what you're talking about. This is not a common topic. You mentioned only 1% of people who are eligible for bariatric surgery actually have the procedures. And it's something that, as we've talked about, is maybe a little bit taboo still in our society, but certainly has its benefits. And so, again, thank you so much for being just so open with us and in sharing. I know that just as you kind of broke things down for us on this episode, you do the same thing on your own social media. So you got the Coalition Talk Show, right? So that's a wellness-focused podcast and YouTube series. Tell us a little bit about those and just where folks can find you otherwise to hear you talk so much more about what you're so passionate about.
Thank you so much, Dr. Brittany Anderson. I am very passionate about my health and wellness show, The Coalition Talk Show. As you stated, it is a web series on YouTube. You can find it on YouTube. It is The Coalition Talk Show. My channel on YouTube is Dr. Shani Belgrave. We cover a broad variety of topics, ranging from a lot of women's health, but we also have some men's health things like prostate cancer. And then there's also unisex topics, heart health, colon cancer screening. And one of the things I really like about the show is most episodes I bring on an expert from a particular discipline so that people are getting 20-minute snapshots of great medical information that is vetted. Because sometimes when people go online and they try to Google different things, they can get very stressed out, they can get confused. And sometimes it can even be detrimental. So while I encourage everybody to do your research and look things up on your own, the show is meant to provide some real expert guidance.
Absolutely. And same thing with Headed to Healthier. And you are certainly an expert in your field. And I appreciate you so much, Dr. Belgrave, for being here. Tell us a little bit more about your practice, also where people can find you. I'm going to include links in the show notes as well. And then give us final words if there is anything you'd like to leave the audience with, whether it is related to bariatric surgery, obesity management, anything at all. We'll give you final words here.
Thank you so much. So I would say I would love for everyone to check out my website. You can find me at www.drshanibelgrave.com. On there are links to the podcast, as well as a link to my practice, Oneka Bariatrics. The practice website is www.onekabariatrics.com. I love Instagram. And so you can follow me on Instagram, Dr. Shani Belgrave on Instagram. And my final takeaway message would just be one of my favorite quotes: there are no limits. So I would encourage everyone watching, whether you're looking at challenges in your health or trying to live your best life professionally, just to be motivated and remind yourself that there are no limits.
That's right. There are no limits. Dr. Shani Belgrave, thank you so much for joining the Headed to Healthier podcast. I appreciate your time so much, and I wish you the best in all you do. Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.